The latest subvariant of coronavirus is spreading fast, an offshoot of the Omicron variant, the BA.5 variant, now the most common form of COVID in the United States. Joining us to talk about it, Dr. Jeff Potoff, UW Health's Chief Quality Officer. Doctor, great to see you. I mean, the experts call this the most transmissible variant yet. Are we seeing that here in Wisconsin? It seems to be spreading.
We are seeing BA.5 here in Wisconsin, and the other experts are right. This virus, as it mutates, it becomes a better virus. Usually two things involved in that. One is increased transmissibility, so it's much easier to catch it. You don't have to be in contact with someone with COVID with the BA.5 variant very long to get the symptoms yourself. And it's better at defeating our immunity, whether it's vaccine-induced immunity or natural immunity. It doesn't necessarily make you sicker, but your likelihood of having symptoms, even if you had COVID before, is up there.
Okay, I mean, I have a question about immunity. A lot of people do. So if we got sick in the past, whether or not we're vaccinated or not, how long are we at risk until we can get sick again? How long is the immunity lasting for now with this new variant out there?
You know, we have some small studies, and some studies suggest, 30 days for natural immunity. Some would say maybe 2-3 months. We're around that same time frame for those who are vaccinated, boosted. Initially, once you get vaccinated, boosted, pretty high, maybe up to 80% protection, but quickly wanes over the course of 2 to 3 months to maybe 30% protection. So, there's just not as much guarantee that you're not going to have any symptoms at all with these more effective variants. The only thing that's really the silver lining is that severe disease, needing ICU care, still doesn't seem to be up compared to previous variants, people who've been vaccinated, infected before.
Yeah, to that point, I mean, hospitalizations, the numbers show they are climbing, not nearly what we saw last January, but more than triple the number from what we saw in the spring. So if we are vaccinated or we have that natural immunity, do we still end up in the hospital with the new variant?
I think at a lower rate, and there's two kind of hypotheses as to why we might be seeing hospitalizations go up. One is BA.5 more likely to land you in the hospital, even if you're vaccinated, boosted, or previously had an infection? We think that's less likely. What's more likely is with all the availability of home tests, the true number of cases of B5 is probably severely underreported. So as a percentage, the number of people in the hospital is probably still low. It's just we don't know the total number of cases of BA.5 at this point in the pandemic.
Yeah, and all those testing centers have closed. A lot of people don't even test at home anymore, which they should be doing. All right, here in Milwaukee and Waukesha counties, we've moved into that high category for community transmission. That's the highest level that's out there. So we know it's spreading. Down the road in Chicago, they're in the same boat. But the city's top doctor there says there's no reason for residents to let COVID control their lives. I mean, across the country, health experts, they seem less concerned about another crippling surge of hospitalizations. What does your crystal ball tell you about here in Wisconsin?
Yeah, I do think we are going to see an increase in cases. I don't think we have to be as concerned about it as we were before. Now, I don't want folks to get too laissez-faire. It's true that most people who get infected with BA.5 are going to have moderate disease. It's not going to be a walk in the park, but it's not going to land you in the hospital. But there are some reasons to be worried about that. We want to decrease the frequency by which this virus is transmitted, because the more people that get it transmitted, the more likely we have another variant that develops, and that could rain on our parade for developing a vaccine that combats the most frequent variant. We might be a little bit too late in developing that. The other reason is there's lots of people in our communities that are at risk. Those who are immunocompromised on cancer treatments, things like that, they aren't afforded that same protection with vaccination or previous infection. The world's a little bit more dangerous place for those folks.
We've had a lot of parades that have been rained on throughout this pandemic. A lot of information, all good stuff. Dr. Jeff Potoff with the UW Health. Appreciate your time.